How do doctors classify different types of stroke? When it comes to understanding strokes, doctors classify them mainly by their causes and how they affect the brain. The two primary categories are ischemic strokes and hemorrhagic strokes, each with its own subtypes that help in diagnosis and treatment. Ischemic strokes are the most common type. They occur when a blood vessel supplying the brain gets blocked, which reduces blood flow and oxygen to the brain. Within ischemic strokes, doctors use a system called the TOAST classification to identify the cause. This classification includes large artery atherosclerosis, where major arteries are blocked by plaque. Another type is cardioembolism, where blood clots form in the heart and travel to the brain. Small vessel occlusion refers to blockages in small arteries, often leading to lacunar infarcts. There are also strokes of other determined etiology, which are rare causes like dissection or hypercoagulable states. Finally, some strokes have undetermined etiology when the cause remains unknown after thorough investigation. This classification helps doctors choose the right treatments, such as anticoagulation or antiplatelet therapy. On the other hand, hemorrhagic strokes happen when there is bleeding into or around the brain. This type is divided into two main categories. The first is intracerebral hemorrhage, where bleeding occurs directly into brain tissue, often due to high blood pressure or vascular malformations. The second is subarachnoid hemorrhage, which involves bleeding into the space surrounding the brain, usually from a ruptured aneurysm. Managing hemorrhagic strokes focuses on controlling the bleeding and reducing pressure in the brain. Another important term to know is transient ischemic attack, often called a mini-stroke. This occurs when there is a temporary blockage of blood flow to the brain. Symptoms of a TIA resolve within 24 hours, but it serves as a warning sign for a higher risk of future strokes. Doctors also consider factors like the location and size of the stroke, which can affect how a patient presents and their recovery. They may use scales like the National Institutes of Health Stroke Scale to assess the severity of symptoms. Large vessel occlusion strokes are identified for specific treatments, such as endovascular thrombectomy, which involves removing clots from major arteries. In practice, doctors use imaging techniques like computed tomography and magnetic resonance imaging, along with clinical features and diagnostic tests to classify the stroke type and cause. This classification is vital for making informed decisions about treatment, preventing further strokes, and planning rehabilitation. Overall, classifying strokes is a structured process that follows scientific guidelines, ensuring that patients receive the best care tailored to their specific needs. Always consult healthcare professionals for personalized advice and treatment options.